So this study addresses the issue of therapy intensification for patients who are on basal insulin with type 2 diabetes who remain uncontrolled. A lot of times in the clinic we're limited on therapy intensification because of the concern of worsening hypoglycemia, weight gain, or treatment complexity. So in this study, in the Dual 7 trial, we aimed to examine the efficacy and safety of a once daily combination of IDegLira versus basal-bolus therapy. The trial design, it was a phase 3B multinational open-label 2-arm parallel randomized treat-to-target trial. Here you can see in the schematic here, patients had type 2 diabetes. They were randomized 1-to-1 to IDegLira plus metformin versus insulin glargine plus insulin aspart with the major meals. The treatment duration was 26 weeks. The primary endpoint was changed from baseline A1C after 26 weeks of treatment. And the confirmatory secondary endpoints were the measurement of number of treatment emergent hypoglycemic events or the change in baseline in weight. So we're going to move on to our baseline characteristics for the two different treatment groups. You can see very little differences between the two treatment arms. And I just want to draw your attention to the duration of diabetes, quite a long duration of diabetes, 13 years mean between the two groups. Now we'll go on to our primary endpoint. So this is the change in A1C during the trial. You can see the drop in A1C in both groups to the end of trial, leading to a non-inferior, not statistically significant difference in the change in A1C at the end of trial between the two treatment groups. Now we'll move on to our secondary endpoints. This is where you start to see IDegLira differentiates itself from basal-bolus insulin therapy. Here is the change, or the rate of symptomatic hypoglycemia during the duration of the trial. Right away, you see a difference in the lines. This is insulin glargine and insulin aspart basal-bolus versus IDegLira. There's an 89% reduction in the rate of hypoglycemia between the two treatment arms. Moving to weight gain, you see right away at the beginning of the trial, the arms start to go in opposite directions. There's an increase in weight in the basal-bolus arm versus a decrease in weight in the the IDegLira arm. And lastly, we look at the total daily insulin dose, quite significant between the two treatment arms. You see 84.1 units at the end for the basal-bolus arm versus 40.4 units at the end for the IDegLira arm. This graph really illustrates nicely the insulin-sparing effect of IDegLira. And in conclusion, once daily injection of IDegLira provides efficacious intensification option for patients with type 2 diabetes who are not controlled on basal insulin. Additionally, we see a lower rate of hypoglycemia, reduced weight gain, and obviously decreased treatment burden when we're comparing one injection a day versus at least for the most of the patients, 2/3 of the patients, 4 or more injections a day. Thank you.